Hi, my name is Sonam Dhaliwal. I'm a BCIT student nurse, and I will be talking about inverted nipples with preterm infants. So just a short outline, the teaching will be about the condition, pathophysiology, causes, and factors. Secondly, cues, which are signs and symptoms of the condition. Thirdly, I will talk about the situation, what could be happening with a mom-baby in the feeding relationship. Fourth, I will talk about treatment and support. Finally, I will evaluate the care I have provided. In terms of the situated clinical decision-making framework, we have cues, judgment, decisions, and evaluations, and we have knowledge in the middle. So they all work together with each other, as you can see. So in terms of knowledge, I'm going to talk about some benefits of breastfeeding specifically for preterm babies. There's decreased incidence of infection. There's decreased incidence of necrotizing enterocolitis. There's increased feeding tolerance. There's enhanced neurodevelopmental abilities. There's decreased hospital admissions, and there's enhanced bonding with the mother. So knowing this case, breastfeeding will be more time consuming with preterm babies. They require additional time to learn to breastfeed. Breast milk does not provide enough nutrition for preterm babies, so you need to consult with your healthcare provider. Preterm babies may have very low birth weight, which would mean that they would require additional supplementation. So applying this framework, knowing self is important. So strengths, preconceptions, skills, experiences, assumptions, it's important to consider these things. So in terms of knowledge, that's the next thing I'm going to move on to. For patho, normally the nipples protrude. So if you look at this image, it's the first one, it says regular. That's how normally nipples look like. When they're retracted, the nipples are inverted. So right here. So the cause of this is either they're born with it, which is pretty rare. It's due to breastfeeding. It can be breast infection. It can be genetics. So when we talk about factors that are at play for this, obtaining a latch with preterm babies is more difficult than full term. Often it takes many attempts and an increased gestational maturity to obtain an effective latch. Due to be assessing for stress cues for the preterm babies, and the length of the breast increases as the infant matures. Other factors at play is gestational age. As the older the infant gets, the better they are at sucking. Getting the preterm baby to suck on a pacifier finger may help for rhythmic sucking of the breast later on. An important point that the Lillesh League makes is that the babies breastfeed, not nipple feed. So as long as the baby can take a good portion of the breast into the mouth, most types of inverted nipples may not cause problems. Latch and position is also important to note. So in terms of diagnosis of inverted nipples, we do what they call a pinch test, such as this imagery here. So the diagnosis is done by taking the thumb on the top of the breast and the forefingers below. And if your nipple inverts, that means you have an inverted nipple. If it protrudes, then it's a normal nipple. So moving on to cues. If your baby is not gaining weight appropriately, like how I just showed on the image, if the mother's nipples are inverted upon palpation, a visual inspection is also done. Engorgement will add to the problem with the inverted nipples. Some cues to look out for the babies, if they have difficulties in terms of autonomic respiratory pauses, color changes, tremors, yawning, or coughing. In terms of motor, if they're flaccid, if there's finger splaying, there's diffuse activity. Finally, a state system if they're fussy, irritable, disorganized sleep, they have gaze aversion. So when I talk about judgment now, we talk about what is happening with the mother-baby and the feeding relationship. The bonding may be affected for babies in preterm, since they would likely be in a NICU. So some things such as developmentally supportive care, like kangaroo care, may be beneficial to aid in bonding. So factors affecting the mother and the neonatal feeding relationship. The mother's self-efficacy and confidence is going to be important. Her support system will also be important. Assessment based on communication on the part of the nurse will also be important. And finally, involvement with a lactation consultant, public health nurse, midwife, doula, etc. may be helpful for the mother. Regular visits with these practitioners may offer benefit for the mother. So if I talk about my 3 important priorities for this challenge, first is the assessment of the mother and the baby. Secondly is the treatment recommendations. Third is supporting the client and empowering the client so that they are able to take care of themselves when they go home and they are confident in their abilities. So in terms of treatment, I'm going to talk about one treatment that is, firstly, there's some conflicting information that I found, which is, it's called Hoffman's technique, or exercises to evert the nipples. So the literature states that it may be dangerous, especially when the mother is pregnant in the 3rd trimester. Stretching the nipples may cause uterine contractions, and in even some rare cases labor, which would be harmful for the baby. And alternatively, Leslie states it's okay to do so, consult with your healthcare practitioner. So the client will have to be cognizant of these exercises with consulting with their primary care practitioner. Pumping to evert nipples is another treatment option. And also, of course, there's the electric pumps. So the breast is pumped on a low setting until the nipple is protruded, and it's offered for the babies. Lactation consultant support may also be helpful. This one-to-one support will offer help with positioning and latch. They may suggest calming techniques for the infant and other techniques to support breastfeeding. Finally, breast shells may be effective, which is this. So it's plastic discs with holes in them, and they're domed, and they go into a well-fitting brassiere. They help to evert the nipples. Finally, pulling back on the breast tissue during a latch. So the thumb is on top of the breast, the 4 fingers below, and it pulls back on the breast towards the chest wall to help the nipple protrude. Finally, coming to the point of evaluation, these approaches help avoid the risk of never initiating breastfeeding. These interventions will help the mother be self-confident in her own abilities. Based on the diagnosis and assessments described, the mother will be able to identify if she has inverted nipples or not. Alternative consultation can be done with a doula, midwife, GP. The interventions discussed are based on multiple scholarly resources. So just a short summary of what I've talked about today. Knowledge of what inverted nipples are, how it relates to preterm babies, the factors that are at play for infant feeding with inverted nipples in preterm babies, cues to look out for, judgment in this situation with what will be involved, and finally treatment options which will benefit the mother. So this concludes my discussion of inverted nipples with preterm babies. I hope you found this discussion helpful. Thank you.